Hey y'all, happy Friday. It is Dr. Ebony Rollins, family nurse practitioner, nurse educator, nurse entrepreneur, and curator of the Confident Clinician. And it has been a very long week, compiled on top of this long day. And for those of you that don't know, I'm the director of a doctoral program at a university right now. And today we had our institutional report out that is done at the university. And because the program that I'm over, the DNP portion is new, it was my first time doing it. So that was an experience. So that added just a little bit of stress to my day today. And then I had a full clinic day. What I want to talk about today really quickly is there's been a lot of conversation between some students that I have, some recent graduates from other programs that I've worked with, and just some of the new nurse practitioners that I mentor. There has been a lot of conversation around the fact that nobody really addresses or talks about the gap that is created, and I call it an authority gap, right? And that's where you really realize that there's a huge transition that needs to take place for you as a nurse practitioner, not just professionally, but you need to do it in every area of your life, because nobody tells you how hard it is to go from being a very skilled, competent, registered nurse to being a novice nurse practitioner, right? So before I became a nurse practitioner, I was a nurse for 13 years, and I had worked everything from corrections to dialysis to neurosurgery, open heart surgery. I traveled. I was a school nurse. I mean, everything I could do, I did. I was a nurse leader, all those things. And I was very confident, proficient, which also led to me being able to present myself in a certain way professionally, because I really was that confident. And I don't think there's enough conversation had around the fact that we are raised a certain way in nursing. You know, you get out of school, you work with a preceptor for 12 weeks, 16 weeks, that kind of stuff. And I hear so many new nurse practitioners saying, you know, I want you to pay me $150,000 right out of school, but I also want you to train me, right? And to a lot of organizations, they're saying, no, I'm going to show you the policies and procedures, and then we're going to show you how to do the medical record system, the billing. The rest of your training, though, you should have gotten in school. Now, of course, there's checks and balances. If depending on your state and how your things are set up, you have somebody that's, you know, reviewing your notes and making sure everything is the way it's supposed to be. So that's not what I'm saying. I'm talking about in the moment when you are seeing a patient and, you know, you're having to make the decision. So when you don't know what to do, how do you immediately shift yourself to thinking like a clinician? Not how you thought in clinicals, because now your preceptor's not right next door. She's not right outside, right? And there probably is going to be a physician in the office with you, but they have their own patients to see. So what do? Here are my 3 top tips. Number 1, remember that you deserve to be there, okay? Because a lot of this is going to be imposter syndrome. Remember, you deserve to be there. Number 2, remember that the patient is depending on you, right? They are depending on you to help them, to care for them, to be compassionate, to be empathetic, all of those things. The last thing I'm going to say is remember your core values, not your why. Remember your core values, whatever they are: integrity, excellence, respect, empathy, trust, whatever that looks like for you. This is when you really have to remember it and lean into it, and don't shy away from it, so that it can hold you up while you are doing the best that you can. And of course, always, always, always ask for help, because that never goes away. It doesn't matter how long you've been doing it, that never goes away. So if this was helpful and you know somebody that probably could use this encouragement and this information. You know, they're having struggles, they're second guessing themselves. Like, comment, share, and I will be here every week. As I'm in my clinic, as I'm working through my own perils as a clinician, I will be here so we can share. We can discuss, and really create an environment where we can have some real discussion, okay? I hope y'all have a good weekend. And I don't know where you are, but I'm in Florida and the weather is turning quite nice. So I'm hoping to get outside a little bit. Y'all have a good day.